What kind of medicine is Viagra that increases sex power? Is its consumption harmful or not? Agency. What kind of medicine is Viagra that reduces impotence? How does it reduce sexual impotence? Is its consumption harmful or not? Among the various inventions of medicine, this is also a popular invention. Viagra helps people suffering from anxiety and inferiority complex due to sexual impotence to regain their masculinity. In a society like Nepal that has not yet become open, it is difficult to discuss sex. The process of ejaculation occurs in stages. For this, sexual desire must be aroused, the genitals must be stimulated. Only then is ejaculation possible from an aroused penis. In fact, even in the sleep of a normal man, the genitals are stimulated 4 to 8 times. And sometimes, a dream of having sex with someone also causes ejaculation in sleep. The blood flow in the genitals plays an important role in keeping it in a state of excitement. The male genitals are like balloons. Just as a balloon becomes larger after being inflated when the blood flow pressure increases in the male genitalia, the cigar-shaped structures in the penis temporarily block blood flow, making the penis hard and long. When a man is aroused, the arteries that carry blood to the penis open, while the veins that carry blood back constrict. As a result, sufficient pressure is created in the penis, making the penis long and hard. If the arteries that carry blood to the penis do not open properly, the penis cannot become aroused, and the man becomes a victim of sexual weakness. As age begins to touch, the blood vessels, arteries that carry blood to the penis cannot open sufficiently. Viagra promotes the action of nitric oxide in the penis. This relaxes the muscles of the male genitalia, due to which, as the blood flow increases, the smooth muscle of the penis gradually becomes as hard and rigid as a stick, that is, arousal is created. A major breakthrough was made in 1983 in the solution to sexual weakness. Previously, sexual dysfunction was considered a purely mental problem. At a gathering of urologists in the United States in 1983, Dr. Gilles Windle came on stage with an injection of phentolamine in his own penis and took off his pants in front of everyone, proving that the drug could also stimulate the penis. In the mid-1980s, patients with sexual dysfunction would temporarily regain their masculinity by randomly inserting needles into their penises. However, Viagra, which was developed in the form of a tablet that can be taken orally since 1998, made it just as effective and much easier. And while phentolamine brought sexual arousal immediately and uncontrollably, the effects of Viagra were only visible after a person expressed sexual desire. Launched by Pfizer 2 decades ago to target those with sexual arousal problems, Viagra changes the blood flow to the male genitals and brings about the desired thickening. Viagra has become popular among middle-aged men in recent years due to its claims that it increases sexual desire, sexual ability, and penis size. An Argentine team won the Nobel Prize in Aeronautics in 2007 for discovering that Viagra helps relieve jet lag after long flights. Athletes have also been using Viagra to improve their performance, knowing that Viagra increases blood flow to the muscles. Viagra is also used in the prevention and treatment of high blood pressure and high blood pressure. It is used to treat erectile dysfunction caused by the disease or the drugs used for it in patients with diabetes and depression. For erectile dysfunction, 25 to 100 milligrams of Viagra can be taken once, after 4 hours before sexual intercourse. If you take more than this in a day, negative effects will begin to appear. Most people experience side effects such as headaches, hot flashes, runny noses, blurred vision, difficulty seeing in bright light, and some people see everything as blue. Rarely, genitals become constantly aroused, blood pressure drops suddenly, heart attacks, strokes, and sudden hearing loss. People taking high blood pressure medication and HIV medication should not take Viagra. In such cases, Viagra increases the negative effects. People taking heart medication, those at risk of heart attack if they have sex, those with severe liver and kidney disease, and those who have recently had a stroke or heart attack should not take Viagra.